Adult rhinosinusitis. Definition: sinusitis or rhinosinusitis is inflammation of the paranasal sinuses. It can be due to infection, allergy, or autoimmune problems. Most cases are due to a viral infection and resolve over the course of 10 days. It is a common condition with over 24 million cases annually in the U.S. Classification: acute rhinosinusitis, recurrent acute rhinosinusitis, chronic rhinosinusitis, acute exacerbation of chronic rhinosinusitis. By location: maxillary, frontal, ethmoidal, and sphenoidal. Physiopathology.
Nasal sinuses, or sinuses for short, are the four pairs of mucus-lined hollow spaces inside the bones of the face and skull. They are located on either side of the nose, the maxillary sinuses, in between the eyes, the ethmoid sinuses, behind the eyes, the sphenoid sinuses, and in the forehead, the frontal sinuses. Though their exact function is unknown, it is thought that the sinuses help to warm, humidify, and filter inhaled air, regulate pressure within the nose, contribute to immune defense, lighten the weight of the skull, give resonance to the voice, absorb shock from blows to the face, and contribute to facial growth. By producing half a liter to a liter of mucus each day, which empties into the nasal cavity, the sinuses contribute greatly to air filtration. Tiny hairs called cilia propel the mucus into the canals, or meatai, of the nasal cavity through tiny openings called ostia. The anterior or front ethmoid sinuses, the frontal sinuses, and the maxillary sinuses all empty their mucus into the middle meatus, creating a congested area called the osteomeatal complex. The posterior or back ethmoid sinuses and the sphenoid sinuses empty mucus into the superior meatus. Regular clearance of mucus into the nasal cavity keeps the sinuses hollow and sterile. This clearance depends on healthy cilia, thin fluid mucus, and unobstructed ostia. A change in any of these factors, therefore, could hinder normal mucus clearance and lead to sinus inflammation and infection. The inflammation or swelling of one or more sinuses is called rhinosinusitis. Originally called just sinusitis, the term now includes the Greek word rhino, meaning nose, as we have since learned that the sinuses and nose are most often inflamed together.
Understanding rhinosinusitis.
Humans breathe between 12 to 20 times a minute, inhaling 500 to 700 milliliters of air at a time. Air enters the respiratory tract through the nose and the mouth, is heated, filtered, and humidified by the nose and the sinuses, and travels through the pharynx, larynx, and trachea to the lungs, where it exchanges oxygen for carbon dioxide. Lining the respiratory tract is a membrane that secretes mucus, a thick, slippery fluid that warms, moistens, and filters the air. Mucus protects the respiratory tract by trapping bacteria, dust, pollen, and pollutants we would otherwise inhale. It lines the sinuses in two layers, an inner liquidy layer, which moves easily, and an outer gel layer, which catches any debris. Tiny hairs called cilia, which beat up to 1,000 times a minute, sweep the mucus in a specific pattern toward the throat, where it is swallowed and disposed of in the stomach.
A doctor's explanation.
Allergic rhinosinusitis refers to the inflammation of the lining of the nasal passages and the facial sinuses. This occurs when specific substances called allergens get into these areas and cause irritation. When the irritation occurs, it causes excess mucus production, sneezing, runny, watery eyes, and nasal congestion. You may also have itchiness of the eyes, ears, nose,